Good evening, doctors. Welcome to Dream. So it's time for free Friday masterclass. Okay, so this Friday's topic is vitamin D in pregnancy, the most neglected topic. We as obstetricians and gynecologists, we concentrate more on iron deficiency anemias, and we concentrate more on iron, folic acid, and vitamin B. But this is the most neglected vitamin, but this is it plays a major role in pregnancy and in all the other aspects. So let us have some knowledge about vitamin D and its impact in the pregnancy. So there is a global prevalence of 18 to 84% of vitamin D deficiencies in the pregnant women, and this varies by ethnicity, country, clothing, and diet. So, who are the high risk women that are exposed to vitamin D deficiencies are the indoor workers who does not have adequate exposure to the sunlight, and the vegetarian people, and the women in the cold climates or who wear sun blocking clothing, like the people who are wearing burqas in Muslim women. So they are also will be having a vitamin D deficiencies, and some ethnic minorities with a darker skin also will be having the vitamin D deficiencies, and these are at risk people. So let us have some idea about the sources of vitamin D. So you need to tell your patients to have a good source of vitamin D. So first of all, we need to know in what forms you will have a good amount of vitamin D. The first is the cow's milk. So cow's milk contains around 100. So around 100 you will be having cow's milk, soy milk, and orange juice. Okay, so the orange juice which is fortified also will be having the vitamin D. Now coming to the pink salmon. The pink salmon fish contains 530, and the highest is herring, which is not very easily available in our settings, but this is the highest form where in the edible form, okay, in the natural form. And whenever you get with the vitamin D3 supplements, you will be having 2000, and if you are having a prescription one, now it is coming like 60,000. Okay, now it is like 60,000 international units of vitamin D can be given. Okay, so these are the major sources of vitamin D. Just have a look. Now coming to the synthesis and metabolism of vitamin D, how you are going to have a very clean the metabolism of vitamin D. So you will be having three things. The first is skin synthesis, and then from the liver, and then from the kidney. So coming to the skin synthesis, so from the skin you will be having exposure to the sunlight. So this UV rays will convert the 7 dehydrocholesterol in your skin to cholecalciferol. Okay, the 7 dehydrocholesterol will be converted to cholecalciferol after some steps. So what are those steps? So the 7 dehydrocholesterol will be converted to, first is pre-vitamin D3. Okay, the first is the pre-vitamin D3, then it will be converted to vitamin D3, that is cholecalciferol. Okay, so this cholecalciferol directly enters into the RBC. Now coming to the liver. So what happens in the liver? This cholecalciferol, when it enters into the liver with the enzyme 25 hydroxylase, it converts into 25 hydroxy cholecalciferol. So this chole will convert with the help of enzyme 25 hydroxylase to 25 hydroxy cholecalciferol. Then this 25 hydroxy cholecalciferol enters into the kidney. Okay, enters into the kidney and converts into 125 dihydroxy cholecalciferol, and this is the active form. Okay, this is the active form which is useful, and this is again reabsorbed into the blood. Okay, this is the active form 125 dihydroxy cholecalciferol. So now it is easy, but later on when you are going to revise, or whenever you are attempting some need super specialities or need PG examinations, then you can get a doubt like 25 hydroxy cholecalciferol is in liver or kidney. 125 is kidney or liver. So just remember, kidneys are 2. Okay, so you have 2 kidneys, so the numbers will be 2. Just as simple as that, remember like that, so you'll not get confused every time. So liver is 1, so only single number, that is 25 hydroxycholecalciferol comes from liver. And in the kidney, as the kidneys are 2 in number, you will have 2 numbers, that is 1 and 25. So with the help of 1 alpha hydroxylase, the 25 hydroxycholecalciferol is converted to 125 dihydroxycholecalciferol, which is the activated form of vitamin D. So every time when we read about vitamin D or calcium, we hear about a hormone, that is parathyroid hormone. So how this is helpful? This is a parathyroid hormone. This is present in the kidney, and this is activated by the 1 alpha hydroxylase will be activated by the parathyroid hormone. Okay, whenever there is a low calcium in the blood or low calcium in the plasma, this parathyroid hormone will be activated, and this will activate this enzyme 1 alpha hydroxylase, okay, for the production of vitamin D. So let us know what is the importance of vitamin D in pregnancy. Why we are so much concerned about vitamin D? Because this is essential for calcium and phosphate absorption, both from bones and the intestine, and this is also helpful for the bone health. Okay, so whenever there is a deficiency of vitamin D, this is associated with rickets, gestational diabetes, preeclampsia. So we neglect vitamin D, we have to get ready with the consequence of preeclampsia. Okay, so there might be preeclampsia, small for gestational age, infants, low birth weight, and oligohydramnias. Okay, so preeclampsia is the one important thing where vitamin D deficiency plays a role. Coming to the outcomes, so what are the adverse outcomes with response to the level of vitamin D? So usually, if it is less than 10, then it is known as a severe deficiency. If the serum 25 hydroxy levels are less than 10, then it is known as severe deficiency, and you will be having the preeclampsia. Okay, there is an increased risk of preeclampsia. Okay, and calcium malabsorption will be there, bone loss will be there. Okay, and myopathies also will be there. So this is about the severe deficiencies in the maternal side. Coming to the newborn side, whenever there is a vitamin D deficiency, you will be having SGA fetuses, and seizures, hypocalcemic seizures could be there, which is life threatening, and fontanelle will be large, rickets. Okay, rickets also could be there. Coming to the insufficiency means like 11 to 32. Okay, in this you will be having a small bone loss, and hypocalcemia could be there. It's not as severe as the previous one. So adequacy, the 32 to 100 is the adequate level. Okay, 32 to 100 is the adequate level. Now coming to toxicity, if it is more than 100, then it is toxic. Okay, in some areas you can have the toxicity also. So if you have overcorrection of vitamin D, you can have a toxicity. So this leads to hypercalcemia, and there will be increased calcium loss in the urine, and infantile hypercalcemia also could be there. This is a very rare condition because all of us will be more or less deficient with the vitamin D. So we can fall in one of these categories. Okay. So you can pause this video and you can have a screenshot, or you can just go through the tables once again. So coming to the recommendations, then what you are going to recommend, how much amount of vitamin D you are going to recommend. The minimum serum level should be more than or equal to 20, and the optimum level is around 30. So the supplement dose would be around 600 to 4000. Okay, the supplement dose would be around 600 to 4000 international units per day. So if there is a high risk women, or if already a vitamin D deficiency has been diagnosed, then weekly dose of, now it is 60,000. Okay, weekly dose of 60,000 international units every week under supervision should be there, and this is recommended usually around 4 to 8 weeks. Okay, this is usually recommended around 4 to 8 weeks, based on the vitamin D levels. Okay. So we got to know that vitamin D is very essential for the maternal and fetal health. That's why a regular vitamin D screening should be given in cases of high risk women, and based on the deficiency status we have to give the supplements. Okay. So just we need to be cautious, like routine supplementation is also preventing the baby's complications and the mother's complications, so it's good to have a routine supplementation in the pregnancy. Okay. So that's all for this class. Thank you for your patient hearing and happy learning. Thank you.